Well, my particular denomination, the Christian Church of Disciples of Christ, has an identity statement that I will share with you, which sort of sets my theological position on this. We say we are disciples of Christ, a movement for wholeness in a fragmented world. And then we go on to say, we welcome all to the Lord's table as God has welcomed us. We do have an open table, as they say. But that phrase, a movement for wholeness in a fragmented world, really, interests me and is a part of my passion. All churches are movements, at their best, are movements for wholeness in a fragmented world. Most churches, there are two core values of faith as it relates to the social witness of the church. One is charity, the value of charity, the core value of charity. The other is justice. Churches, by and large, do excellent work on charity. They do less excellent work on justice. And I think we need to address that. Years ago, I heard or read Archbishop Dom Helder Camara from Brazil, now the late Archbishop, who was known as the Martin Luther King of Latin America. He was Archbishop in Recife, Brazil. And he said, when I do acts of charity, I'm called a saint. When I cry out for justice, I'm called a communist. And so I think that sort of graphically underscores the need for working for justice. Cornel West, an African-American theologian, has said justice is the way love looks like in public. And so public policy for people of faith must be a part of our agenda, but it all too often is not. And I'm glad to know that there are some pastors who take it seriously. And so public policy should be a part of the church's agenda, and some of us are working to see that occurs.
What about you, Jason? Where do you see the role of the faith community? Where do you see the intersection between healthcare access and your mission as a faith leader?
Well, I think it's all one and the same when we look at the way the Bible talks about it, right? If we go to the book of Numbers chapter 21, verse 9, God told Moses, he said there were serpents that were around, they were biting the people based on their complaining. God told Moses, take his staff, wrap a serpent on his staff, hold it up, right? Place it in the ground, hold it up. When the people look at it, they'll be healed, right? That pole with the serpent around it is where we get our medical symbol today from, right? So it comes from Scripture. So when you talk about healthcare, you talk about medicine, you talk about healing, it's all throughout the Scripture, right? Jesus is our great physician. Luke, who wrote the book of Acts, he was a physician, he was a doctor. In Colossians chapter 4, it says that Luke was a good doctor, right? And so we see that all throughout people's lives, throughout the Bible, that healthcare is all around. So it's hard to work in ministry and not understand what the role of healthcare is for people, right? Because Jesus, he healed the sick, right? He opened blinded eyes. He did all these miraculous things, right, that we normally would go to the doctor for in certain cases. But back then, they didn't have those kind of modern medicines that we would have today, right? So they had more miracles in that sense. But now God has given us a way to be able to work with each other, to heal each other through modern medicine, right, if we put our faith and trust in God. So I think it all comes together and it all has to work together.
I worked with this guy for 2 years. I mean, he's a high-minded dude. I mean, it can get like exhausting. I'm just kidding.
I underscore that obviously healthcare was a priority for Jesus, as you've been indicated, and the church historically has responded to that by forming hospitals. The church was very instrumental in the formation of hospitals in this nation, and but now we have to address issues from a public policy